Hi, I'm Dr. Kenneth Levine. Welcome to Health Talk. Health Talk is a show about your entire body from the top of your head down to the bottom of your feet. I personally am a periodontist. I'm a dentist who treats gum and bone disease. In my practice, we treat patients of all ages from 4 days old up to 100 years young. But this is not a show about dentistry. This is a show about your total well-being. And tonight, I'm going to be here with Dr. Tom Morrison. Tom, welcome to the show.
Thank you very much. It's a pleasure being here.
I'm glad you're here because you represent another aspect of medicine that people may not be familiar with. Tell us a little bit about your background personally.
Well, I started out in emergency medicine in New Orleans in 1996.
Right.
Then went back to residency for family practice and moved here to Miami for that. Worked as a hospitalist at Jackson in the Jackson healthcare system, and then full-time joined the Baptist Outpatient Services as a urgent care physician.
Well, that's a lot of different hats that you've worn, right?
Yes, that's correct.
You're now an urgent care physician.
Right. My title is Regional Medical Director for the Baptist Urgent Care in Broward.
Okay, so Baptist is a hospital in Dade County, is that right?
That's correct. The Baptist Health Systems originated in South Dade and has subsequently moved to Broward through the urgent care settings and diagnostic centers.
So, if I get it correctly, there's a big hospital called Baptist in South Dade, and now you have smaller facilities spread throughout the community.
That's correct.
Okay. Do you have those facilities also in Dade County? Or
Yes, the urgent care is initially branched in Dade County, and currently we have them as far south as Country Walk, which is basically the equivalent of Southwest 152nd Street, and as far north as Coral Springs.
Now, patients who wander into your urgent care facilities, and then, well, it's found out that, gee, they need to go to a hospital. Are they able to go to the local hospital? Do they then go down to Baptist, or do they get in the ambulance and go wherever they take them?
That's an excellent question. We have a lot of people that don't understand that urgent care primarily is for just that, problems that like lacerations, sprains, fevers, cough, that type of thing. If we have somebody present with chest pain or abdominal pain, more frequently than not, we need a tertiary hospital. If the situation warrants it, for example, chest pain like a heart attack, we'll have to call 911, and it'll be up to the paramedics to go to the closest facility because that's in the patient's best interest. If it's something that the patient can make a decision, we have the patient make that decision, but usually it's a local facility. So for example, in Coral Springs it might be Northwest or Coral Springs Memorial. In Pembroke Pines it's the Memorial system more often than not.
How many facilities are in Broward County?
Currently we have 4, but we have a 5th and the last urgent care to be opened for a while for the Baptist system in Sawgrass.
So where are they located?
They're in Davie, Weston, Pembroke Pines, and Coral Springs, and then of course the one I just mentioned is Sawgrass.
So everything's on the west side of Broward County?
Yes, it's west of 95.
Limited by the Sawgrass, right?
Correct.
Okay. So somebody, are you taking the place of a family physician?
No, not at all, and I appreciate you asking that. We're available for people who the family practitioner can't see. More often than not, they'll call their primary care doctor first. They can't get an appointment, or they'll be told, look, you need more done than we can do here. Go to your local urgent care.
Okay.
And the nice thing about our facility, too, is we're here talking about urgent care because that's what I represent, but most of the sites are dual-purposed. We have the urgent care on one side and literally on the other a diagnostic center. And that's nice because if the primary practice doctor wants to order an MRI or mammogram or bone scan, they can go to the diagnostic center and get that done.
So all of the 4 or 5 facilities have both an urgent care and a radiologic diagnostic
With the
center?
exception of Weston, yes. So 4 of the 5 do.
So you have radiology technicians on call, and then they can communicate with radiologists somewhere is it at Baptist Hospital?
Well, that's an excellent question also. We actually have radiologists on site at Pembroke Pines and Davie. Coral Springs, because it is so far north, we, the urgent care doctors, actually make sure that the patient's safe as far as injections are concerned. But with modern technology, everything gets shipped by computer and is read usually within 5 to 15 minutes by the radiologist.
And in the Broward County or down at Baptist, or it doesn't make a difference?
It does not make a difference, right, right.
You know, it's interesting because my son-in-law is a radiologist at Broward Health, and I know the imaging can take place in one place and it can be read You know, there are places that they read them in India too.
And
I know
yes.
that in the middle of the night. And it's fascinating with the computerization and the details that you guys can get. So if somebody wants to get to you, we're going to talk about how they get to you in just a moment.
Okay.
Be back. I'm Dr. Kenny Levine with Health Talk. We'll see you in just a minute. Thank you.